Hello and happy Black History Month. My name is Kai Kennedy. I'm the Accessibility and Inclusion Training Specialist for the City of Boston's Mayor's Commission for Persons with Disabilities. And in this video, we will be going over the parallels between disability and Black history. The history of the treatment of Black Americans and disabled Americans draw significant parallels to each other. These parallels are especially evident in aspects of life such as civil rights, medical treatment, and job opportunities. And while much has happened to bridge these gaps, there's still more work to be done. You may be familiar with the Voting Rights Act of 1965 as it applies to giving Black women the right to vote, despite Black men getting that right in 1870. It is also the first act that protected the right for for disabled persons to receive assistance at the polls from the person of their choice. The Voting Accessibility for Elderly and Handicap Act of 1984 requires accessible polling places in federal elections for elderly individuals and people with disabilities. If there's no accessible location available, voters must be provided an alternate means of voting on election day. Some of you may be familiar with the term eugenics. This is a form of pseudoscience used to perfect people through selecting or allowing only certain types of people to reproduce. This has a long history of impacting both the disability and Black community. In 1907, Louisiana was the first state to pass mandatory sterilization laws for those in state institutions deemed as idiots, imbeciles, and for women who were deemed promiscuous and feeble-minded. This law remained in effect until 1974. 30 states followed Louisiana, resulting in about 60,000 people forcibly sterilized before the last law was overturned in 1981. Black girls and women were amongst the most targeted during this time due to the stigma that they were promiscuous, and often these sterilizations came after surviving assault. One of the earliest documented cases of experimentation on people with disabilities was in 1895 when two young boys in New York were injected with gonorrhea. In the mid-1800s, a doctor in Montgomery, Alabama, became the first to begin surgical experimentation on Black women without providing any anesthesia. He is also known as the creator of modern-day gynecology. Many of these experiments were gynecological experiments. In the 1940s and 50s, a state school in Waltham, Massachusetts, fed radioactive cereal to disabled children as part of an experiment. And some of these have lasting effects. So today, Black disabled patients often struggle to get a proper diagnosis because of stigmas that began during slavery. The claims that Black men and boys are naturally aggressive and defiant, for example, often lead them to being diagnosed with oppositional defiant disorder instead of autism. There's still a major lack of proper medical depictions of how some conditions and disabilities may show up on different or darker skin, which often leads to missed or misdiagnoses. Black women have a higher mortality rate during childbirth, and some studies report as much as 3 times higher than other racial groups. And some healthcare providers are still made to believe that Black Americans feel pain at a lower rate than other races. And as a result, they often overlook expressions of pain no matter how severe. Today, unemployment remains a major issue in both the Black and disability community. Black Americans hold the highest rate of unemployment among racial demographics at 5.8%, and 8.2% of disabled Americans are unemployed. There are a lot of factors that contribute to these rates, such as access to transportation and accessible education, and more. But many job descriptions are written both intentionally and unintentionally to deter disabled Americans from applying. Language such as must be able to lift 50 pounds when other ways of transporting material are available can discourage disabled applicants from applying. Now, in the workplace, Title 1 of the ADA provides many protections for disabled employees. Many employers still do not fully understand their responsibilities under this act, which means that disabled employees may have trouble getting the accommodations they have a right to. In 2019, California was the first state to enact the Crown Act. This act protects Black employees from discrimination based on their natural Afro-textured hair. As of 2023, only 22 other states have adopted this act, and it is still not passed at the federal level. So, what do we do? Well, for civil rights, we continue to vote in local, state, and federal elections and advocate for acts and laws that support and protect these communities. With medical treatment, we can amplify Black and Brown healthcare professionals, as well as resources for more Black and Brown people to have access to the education necessary to become one. And for job opportunities, employers can search for trainings on accessible and inclusive hiring practices that are led by disabled people or organizations with disabled leadership. You can partner with your organization's diversity, equity, and inclusion office or department to learn how your implicit bias might show up during the hiring practices. And if your organization doesn't have one of those offices, advocate for one to be created. And when you're writing job descriptions, make sure you review the language that is used. Some of it may discourage disabled employees from applying.
Thank you so much for joining us for this training. If you'd like to learn more about disability accessibility, please contact the Mayor's Commission for Persons with Disabilities at Boston City Hall, room 967. Our phone number is 617-635-3682, and our email is disability@boston.gov. To stay up to date on local disability news as well as events that our office hosts, you can sign up for our newsletter by visiting boston.gov/disability and scrolling to the bottom of the page.